So I would assemble my needed equipment, which to me would be a stethoscope, an alcohol pad, and gloves. I also would have my hand sanitizer ready. I'm currently sitting on what is going to be the patient's bed in a room. I would come in, I would greet the patient, and I would check their name and ask them to repeat their name, but also check it against the ID band and possibly even a date of birth if that's available. I would make sure my patient is comfortable, that they're given full privacy, close the door, and I would start with my head to toe assessment, starting with the neurological, observe the patient, their behavior, responses for a level of consciousness, making sure they're alert and oriented. Some questions to use for that would be, do you know where you are? Do you know what day and what year it is? And then I would move on to observing the head and neck, making sure there is symmetry of the eyes and ears. I would ask them if they have any hearing problems, anything that they want me to look at or possibly discuss with the doctor. I would then use my pen light to assess the pupils for perla and verbalize any of those findings. Moving on, I would look at their lips and their oral mucosa, check their teeth, make sure that the mucous membranes are nice and moisturized. I would probably use my pen light again for this, checking the tongue and the back of the mouth. Moving forward, I would go to the upper extremities, assess the upper extremities, making sure the skin temperature is good, that there is good moisture, the skin is not very dry, that there's good skin turgor. I would palpate the radial pulses, making sure that they have good strength and that they're both equal. I would also test the strength of the patient's grip by giving them my hands or 2 fingers and having them squeeze with their left and right hand at the same time to check that. I would check for capillary refill, less than 3 seconds. I would also check that they have good range of motion on the whole upper extremity and ask them if they have any discomfort as I'm doing so. And then I would check sensation by having the patient close their eyes and respond to any questions of where they feel my touch at that point and the sensation that they feel. Moving forward, I would locate the apical pulse by using the correct landmarks. I would auscultate the apical pulse with my stethoscope for 1 full minute and see that I document the rate and rhythm. Moving along, I would assess the chest, make sure that there is good symmetry, and auscultate the lung sounds. I would start in the front or the back, posterior, and lateral sides, listening for good breath sounds. I would also ask the patient if they've had any problems breathing, any shortness of breath, any coughing, which I'd also be listening for as well. Moving along, I would have the patient at that point lie down supine. I would look at the abdomen, visualize in the beginning, just checking for size, shape, any abnormalities. Then I would start to auscultate bowel sounds in all 4 quadrants, starting with the right upper quadrant and working my way around. I would ask the patient about bowel movements. Have they had any issues, any discomfort having a bowel movement, and address those issues. I would also talk about urinary. Are they going frequently? Are they having difficulty? Are they avoiding normal? Making sure that they're okay in that system as well. I would then palpate all 4 quadrants, making sure that there's no masses, there's no tenderness, there's no distension of bowel or bladder, and I would document that if necessary. Moving along, I would assess the lower extremities, checking for edema through the legs and the feet. I would again palpate the skin to check for temperature. I would check capillary refill on the toes. I would palpate the pedal pulse and the post-tibial pulse, making sure that they're nice and strong and that they're equal. I would observe range of motion, again asking the patient if they've had any difficulty moving their legs, their feet, their knees, for example, any discomfort upon when I do it. And at that point, I would have the patient, I would put my 2 hands above their feet, close to their ankles, and I would have them push up off the bed while I sort of have my palms against their left and right legs, lower legs, and check for strength to see if they could perform that. Then I would palpate the legs while the patient had their eyes closed to check for any feeling, making sure that they're feeling correctly, that they are having good sensation where they should be and feeling appropriately. I would make sure that my client is safe. I would make sure that the bed is in the correct position of their comfort. If they were on an aspiration precaution, that I would make sure that they would be in the right position at all times, that if there is a side rail that had to be up for a certain reason, that would be up, and making sure that the call bell is near them so that they felt safe should they need any help. I would then clean my hands with the hand sanitizer next to me, performing hand hygiene, making sure the patient also was covered back with a blanket or a sheet, whatever they're comfortable with, giving them good privacy throughout. For my patient teaching, my patient has elevated cholesterol, so I'm going to teach them about a couple of things to do. So I would talk to my patient and say, you have elevated cholesterol. There are a few things you can do to really manage this and manage it well. You want to start by maintaining a good weight. So a BMI of 20 to 25 is where you would like to be. You are doing well as you are a 24, but we want to keep you within that window. Secondly, I would avoid foods high in cholesterol such as eggs, shrimp, red meat, foods that are fried and overall fatty. You should increase your fiber intake as fiber binds with cholesterol and can be excreted in the body. You also want foods that are very low in fat. Replace some of those foods, if you're currently eating those, with fruits, vegetables, fish, meat that's not red more than once a week, grains, healthy fats such as olive oil or avocado. That can make a real difference in lowering cholesterol and maintaining it. Lastly, you want to exercise for at least 30 minutes daily every day or at least 5 times a week. This is good to maintain your weight as well, heart function, and has many additional benefits to your body. The doctor would like to see you back in 3 months and will order lab work to check your cholesterol then and see if the things that we discussed today are in fact working. There is always a plan B. If they don't work, we can further discuss that when you come back for your visit. So in your words, please tell me what your plan will be from everything we discussed today. And do you have any questions that I can answer to clarify anything? This is my head-to-toe health assessment. I'm testing this out. Next week I will be running through with my patient and I will be doing the physical skills that I verbalized today. Thank you.